Well, it appears formal contract talks between Legacy Health and Regence are at a standstill, putting thousands of patients in limbo. The deadline to come to terms on a new insurance reimbursement plan is 10 days away, and without a new agreement, tens of thousands of patients could be forced to find new in-network providers. Legacy is a major player in providing health care for people in Oregon and Southwest Washington. And Regence is a major health insurance company covering 30,000 people who have Legacy primary care doctors and 100,000 patients who visited a Legacy facility at some time last year. The two sides have been trying to come to terms to renew a payment agreement for most of a year. And in the final month before the contract deadline, a best and final offer from Regence did not cut it with Legacy.
Yeah, the best and final was certainly a surprise to us, particularly 3 weeks before the contract deadline. We thought we would have more time to continue to work together. We have and will always look to find a compromise that's in the best interest of our patients and the broader community.
That's Legacy's Maren Permit, who says what Regence offered does not match the reality of the rapidly increasing cost of health care. And although it appears formal negotiations are off right now, Regence claims it is talking with Legacy's leadership looking for a path forward. In a written statement, it also said, "We're holding the line on unreasonable provider reimbursement demands because our members, customers, and regulators have asked us to rein in the rising cost of health care. We're acutely aware that these negotiations have real impacts on people's lives."
So obviously he has a feeding tube in right now.
Yes, the human impact is real.
Yeah.
Just ask Renee Standstill, whose 5-month-old son Jonah has health issues. He's not breast or bottle feeding and is not able to move his feet. Her Legacy medical team at Randall Children's Hospital is trying to solve the problems with procedures, including surgeries to come.
If terms can't be met, this absolutely disrupts our lives.
The last thing she wants to do is lose the team because she has Regence BlueCross coverage.
And it just, it breaks my heart that we've built these relationships with these doctors and then I can no longer work with them because my insurance says I can't. It just doesn't sit right with me at all.
There is a recent history of Regence being at the brink with a provider and coming to an agreement. Providence Health and Services also asked for payment increases that Regence said it couldn't afford. But in January, on the deadline day, the two came to terms. Jonah's mom, already having a stressful year, is anxiously hoping for the same here. If not,
then it's time for me to kick it into gear and start trying to find a new doctor that will take on Jonah, restart referrals, which takes so long to see specialists. It just starts the clock all over, and we've been dealing with this since January 1st.
You got to hope that they can work it out. Now, Regence told me this afternoon that top leaders from both organizations are communicating, and as recently as this morning. If they don't reach a deal by the deadline, though, there are some continuing coverage option possibilities temporarily for some folks at least, and both sides say they'll help patients transition to other care if needed.